Assalamu alaikum, welcome to my YouTube channel. I am Maria Bhatti. Today we will discuss the management of neonatal asphyxia. There are three management of neonatal asphyxia. Number one, basic steps of management. Number two, medical management. And number three, nursing management. First of all, we will discuss the basic steps of management for neonatal asphyxia. Asphyxia is corrected by resuscitating the newborn infant. If a baby is not breathing, proceed in following orders as quickly. Number 1. Note the time of birth. Dry and cover the baby. Supply heat to the baby. And then use a proper size of suction catheter to clear the airway quickly and thoroughly if amniotic fluid is meconium stained. Then ventilate the baby by ambo bag or mask. Ensure baby's face is looking straight upward to ceiling while ventilating. Prevent air leak around the baby's face. Start by giving 100% oxygen by connecting the oxygen cylinder to face mask. Ventilate at a rate of 40 per minute, and then the breathing out and breathing in should be equal. Allow baby breathe out and see the chest and abdomen moving with ventilation and hear the breath sounds. Apply external cardiac massage if there is no heartbeat. If this is done simultaneously with the ventilation, then a cycle of respiration to cardiac massage of 1 to 3 or 1 to 4 should be maintained. Then there is medical management of neonatal asphyxia. Medical management is regarding the system-wise issues. Correct the respiratory failure, correct the hypotension and shock, and maintain input-output chart. Correct hypoglycemia, hyperglycemia, thermoregulation, metabolic acidosis, sears, hypocalcemia, hyponatremia, hyperkalemia, and then correct the renal failure, coagulopathy, necrotizing enterocolitis, and then start a empirical antibiotics regarding the septic profile or sepsis. First line antibiotic is amikacin plus co-amoxiclav. Second line ciprofloxacin and then piperacillin plus tazobactam. Third line is vancomycin and imipenem and linezolid plus meropenem. All these empirical antibiotics are regarding the results of septic profile, that is septicemia, that is sepsis in the blood or infection in the blood. Then emergency treatment if baby apply these measures above. Then however, if there is no response after 3 to 5 minutes of cardiac massage, then if heart rate is very slow, 0.2 ml per kg of a adrenaline given into 9 ml normal saline. If baby's condition improves, then close eye on him or her. Watch out for convulsions, hypoglycemia, feeding difficulties, hypothermia, and recurrent apnea. But if conditions of baby not improved, then do PPV, positive pressure ventilation, and it is the final emergency management. Management of neonatal asphyxia is: number 1, observe the newborn that has been successfully resuscitated, absence of spontaneous respiration, sears activity in the first 12 hours after birth, and then decreased or increased urine output, which may indicate acute tubular necrosis or syndrome of inappropriate antidiuretic hormone. Then metabolic alterations in which hypoglycemia and hypocalcemia measured, and increased intracranial pressure marked by decreased or absent reflexes or hypertension. Then decreased noxious environment stimulus. Monitor the infant level of responsiveness, activity, muscle tone, and posture. Administer prescribed medications which may include anticonvulsants in which phenobarbital as prescribed the doctor. Provide respiratory support, and then monitor for complications in which measure and record intake and output to evaluate the renal function. Check every voiding for blood, protein, and specific gravity which suggests renal injury. Check every stool for blood suggesting necrotizing enterocolitis. Necrotizing is a condition in which the bowel develops necrotic patches that interfere with digestion and possible cause paralytic ileus, perforation, and peritonitis. Then take serial blood glucose determined to detect the hypocalcemia and monitor serum electrolytes. Administer and maintain intravenous fluid to maintain hydration and fluid and electrolyte. Thank you for watching. If you like my video, subscribe my channel and like this video.